Welcome back. This section of the show is called Ask FPA, your opportunity to ask a question. If you'd like to ask a question, you can send it to tv@fpalex.com. Include your name if you would like us to use it on the air. Tonight's question is, how do I know to go to the ER for chest pain? Asked by Bill Simpson of Lexington, Kentucky. And here to help me answer that is Mr. Todd Martin, the nurse practitioner that works with me at Family Practice Associates. Welcome, Todd. So, how do you know the ER or to the doctor's office?
So the classic symptoms of a heart attack are sudden crushing chest pain, kind of substernally in the anterior chest, radiation to your jaw or your arm, most likely the left arm. Those are the big classic symptoms. If you've got a known history of coronary artery disease, you should be certainly concerned about that.
So if you break out in a sweat, get nauseated, you have a risk factor, and you have all those symptoms, that's probably emergency room?
It's probably a good call for 911.
But not all chest pain is cardiac. And you, I'm assuming, see a lot of chest pain that's non-cardiac in the office.
Yeah, we see all kinds of chest pain. There's multiple causes for chest pain. There's pleurisy, bronchitis, pneumonia, a condition called costochondritis, which is inflammation of the cartilage and the chest wall that you can get from lifting or pulling on heavy objects.
Acid, sometimes acid from stomach washing back into your chest, give you atypical type pain.
One of the most common causes of ER visits is epigastric chest pain, people having acid reflux that mistakenly identify it as cardiac chest pain.
So it's expensive heartburn if you end up in the emergency room for chest pain.
It is. Average cost is over $1,000 per patient.
So you want to try to pick the right place to go for the right disease. So you don't want to ignore something that's life-threatening, but if you can find a simpler, more cost-effective, better way, the office might be a good way to do that.
The office is always a good way to do that. One of the biggest factors that cause people to go to the emergency room is they complain that they just can't get into their doctor's office. Doctors are busy. They have certain limited hours. At Family Practice Associates, we have extended hours into the evening, so we're there Monday through Friday till 7 p.m. for those people who, have to work. You're kind of, I'm not sure what it is, and you just need evaluation. Other than those big symptoms of cardiac chest pain, it's a good idea to call the doctor's office first, and we can usually work you in, figure out what it is, and kind of go from there.
Now, it's important, though, that if you don't have a family doctor, you really ought to.
Everybody should have a family doctor, someone who knows your health history, knows your risk factors, and can piece together that puzzle, because when you go to emergency room, you're seeing people who know nothing about you or your history, and that's why the cost is so high, because they have to start from scratch every single time. If you go to the emergency room 2 days in a row, you're going to get a whole different crew, and the workup starts again.
So if you have a family doctor or a primary care doctor, you have access to a system that knows you, you know them, and even if you require a higher level of care, they can facilitate that for you.
That's correct. And at Family Practice, we not only treat chest pain, we do a lot of other things that they can do in emergency rooms. We do minor surgical procedures if you get cut and you need a few stitches. We have surgical rooms, and we have trained employees that can take care of that wound, save you a lot of money, a lot of time sitting in the emergency room for hours and hours, because your 2-inch laceration gets put on the back burner because of the real emergencies.
Now you talk about, chest pain is a big one, but we can do stitches. And in the summertime, you get sprains, strains. You don't necessarily, for a sprained ankle or a hurt bone, necessarily need to go to the ER. You can get that evaluated in the office also.
That's correct. At our Hamburg location, we have x-rays in the building that we can send you to. We have capabilities of applying splints, steri strips. We have physical therapy there if we need to get that assessed. And we also have the capability of making referrals. If we need to refer you on to a specialist, we can do that there.
There is other things we do too, just like health maintenance to keep you healthy. Vaccinations, physicals.
We do all that.
Do all that.
We do all that.
Do all that. And doing those things keep you healthy, so maybe you don't end up in the emergency room with a stroke or a heart attack.
That's correct. Having your doctor know you and know your personal health history goes a long way in guiding you in the right direction, getting you the appropriate care, cost conserving care, and we can guide you in that correct direction.
And managing diabetes and blood pressure and cholesterol may keep them out of the ER.
Absolutely.
All right, great information.